Suture. And there's something we're going to tie it around. Now, the first thing we learn about suture, and we learned about Halstead, which we learned about in lecture a few weeks ago, is that we don't like to have a lot of bulk in the suture. And the other thing I'll tell you, which I remember right now, is that it takes 2 throws to make 1 knot. Everybody got that? Now, the reason I tell you that is because what you're going to do is you're going to find surgeons, you're going to find people, but mostly surgeons, who kind of don't follow that path. They'll say, put another throw in there, or put another knot in there. And what they mean is 1 more throw. So just know that for us, when we're barely learning, when we're just, we're brand new, 2 throws make a knot. So you always have to have 2 throws to make 1 knot. And the other thing we want to do is we want to kind of create what we call this, not a surgeon knot, but kind of a square knot thing. But we don't want to do that right off the bat. But what we want to do is lay our first throw down flat. And we all know that when we're tying our shoes. If we tie our shoes and we got the strings crossed a certain way, when you put that first throw down, it's twisted. And what do? You take the strings and you turn them around until it lays down so that you can put the little bow in there. Well, so what I did was I went home, and that was really what got me kind of befuddled that first time, was that, oh God, which hand do I want to do this in? Which way do I cross it? Whatever. So I went home, and I just made up a thing, is that I'm always going to cross right string over left string. Always. So there's the throw. I pick up the 2 ends of the string. I cross right over left. Like that, see? Every time I take a throw, I cross right over left.
Doesn't matter which way the needle is.
Well, we're not there yet. That's a whole different story. We're talking about just 1 suture. Don't get ahead of ourselves. We're learning how to tie right now without needles. So right over left. Now, what we're going to do is we're going to grab this right here. See that? See how I got it in my hands? So I'm kind of pointing right out there. And then all I'm going to do is reach around and grab those like that.
Do it again.
Grab it. Got my fingers out like that. I'm just going to reach around and grab those like that. Okay? Now what I'm going to do is I'm going to make a cross, and this is the way I do it. Some other people call it something else. I just call it a cross. I'm going to cross the right string, the right hand, over on top of my finger and make a cross right there on my forefinger. See my thumb sticking up? I don't like that thumb up there, so I'm going to put it down on my first finger, and I'm just going to push through. Then I'm going to open my finger, and I'm going to hand this end of the string to my finger and thumb, put it back together, and push it back through. There's my first throw. Everybody get that? Okay, we'll move on now. Okay, so we got the suture laying out. We cross. We grab like that. We stick our fingers out. We wrap it around. We make the cross. Fingers together, push through, hand it to our finger, push back through, and we got our first throw. Now, this gets kind of complicated. This gets kind of convoluted. Is that what we want to do is we want to throw the same throw as our as our first throw. So you want to go through the exact same maneuver. So what we're going to do is we're going to take that, we're going to grab them like we do, we take like that, we wrap our fingers, we cross over, we put them together, we bring back, and we bring it back through, like that. Now that creates kind of what it's not a true granny knot, but it's a semi-granny knot. What does that mean? That can actually slip a little bit. So if for some reason, and I'll just give an example. Somebody give me, I should use this because it tends to slip a little bit more. That's why we don't use these when we're learning. But say I've got 2 pieces of fascia right there. And I do my thing, so I bring this through, okay? I cross right over left, and I put my first throw down. And what happens is, when I do that, see I pull the tissue together. What happens when I release? Boom, comes back up. So maybe I want to, maybe I'm struggling, and that's very, very, again, we're way, preliminary right now, but let's say that's bow, and we're trying to pull that together, and it's very soft, very friable. If you put a lot of tension on this suture, you're going to rip it right out, and you don't want to do that. What if it's a blood vessel? You don't want to rip that blood vessel out, bleeding, all that. So what we learn to do is we learn to slide that knot. So even though it comes up a little bit, I put the same throw in again, and I've created kind of a little granny knot, and I can slide that baby right down. Now, the next thing I want to do is for my third throw, I want to create what we call a square knot. I want to lock it so that it doesn't slide back up. So if we do it, using the string, the big one, cross right over left, grab my suture, I can't remember what Harrelson calls it. It's actually, he's actually better at this than I am. But I make my little thing, I make my little cross, put the fingers together, push through. There's my first throw. It's laid down, nice. Do the same maneuver like that. Now, just to show you what a square knot is that if you go right over left, okay, and then you go left over right, what you create is a square knot. And you see how they interlock right there? In other words, you can push them up like that, but this is a self-locking knot. The more you pull on this, the tighter it will lock. So this is your locking throw. So I've got that kind of granny knot there that I could push down. Now what I want to do is I want to reverse direction. Instead of going over my finger like that, see that thumb sticking out? I'm going to take my thumb and hook it around there. I'm going to come around like that, make the cross on my thumb, put the fingers together, and push through. And there is my square knot. And my square knot would be right there. See it right there? There's the interlocking thing. So now I've locked that down. Okay? So that's what you want to do. Same direction the first two throws, different direction the third throw. What? Just got lost on that?
I mean, yeah, it's gonna be fun.
Well, this is why we're here, to practice. So you ain't seen the one-handed tie yet. I live for 365 days to show you what's going to go on today. I mean, I have to wait